Good morning, everyone. This is Dr. Pete Peduzzi with another podcast, Wednesday morning podcast. As we look outside, it's flurrying outside, a beautiful winter day. The roads are good, though, so that's the main thing. And just be careful out there. Of course, we always give you tips on winter safety. Of course, driving slowly, making sure you're keeping adequate distance. When you're out there shoveling, make sure you take breaks. Push, don't lift. Try not to twist the body. Push the snow. If you have a snowblower, of course, use it. Again, just making sure you're careful, using your legs, squatting down, lunging, not bending at the waist, not twisting and so on, especially if you are shoveling. And take breaks, especially if you're in the older population. Make sure you take breaks because you can have, cardiac arrest, you can have a heart attack, all types of issues when you overexert yourself, especially as you get into an older age group. So if you are new to our podcast, I'm, again, Dr. Pete Peduzzi from the American Back Centers and the Disc Relief Centers of Pittsburgh. We've helped people for the last 25 plus years avoid the potential pitfalls and permanent complications with spinal surgery. And we see it each and every day with patients coming into our office, seeing that surgery sometimes, in many cases, fails. Now they have scar tissue. They have all types of potentially, if not certain, permanent complications. You see the bishop of the Catholic Diocese here in Pittsburgh, Bishop Zubik, on his 8th or 9th back surgery. It's still not working for him. They're fusing spines as a last resort. We all know that's not the way to go. And that's why we do this. And this is why we're here. We kind of have a niche practice. I am a disc specialist. I've been doing it for close to 20, if not over 20 years now. Dr. Miskovich taught me. He started this practice, and he was one of the first doctors in the country to have a disc specialty center, and we are one of the most experienced centers in the country because of that, helping, without exaggeration, thousands of patients avoid the potential pitfalls of surgery, whether they've already had surgery or not. We all know that each subsequent spinal surgery, whether it's the neck or the lower back, has a lower success rate than the previous. So each subsequent surgery has a higher risk and a lower rate of success. And we all know the risks: infection, bleeding, blood clot, let alone scar tissue. And every time they rip you open, rip out ligament, bone, and tissue to get to the area, there's no greater success rate with each subsequent procedure. We know that you just snip off a piece of bone or take out a piece of bone or snip off a piece of disc. That's all they can do. They can't replace a disc. And even when they tried, it wasn't successful, the procedure. That's why they stopped doing it. Even the Cleveland Clinic will tell you, exhaust all your, some of the best surgeons, I should say, the Cleveland Clinic will tell you, exhaust all your conservative treatment options first before you undergo the knife. They talked about in the Spinal Care Physicians seminar, using VAX-D and physical therapy and other routes first, and avoiding these Band-Aids, these epidurals, pain medication, all these things that are just Band-Aids, allowing your structural problem to get worse. And as it gets worse, you have more problems and a higher rate of failure. And we talk about disc. When you come in, if you have some disc to work with, then your prognosis is much better. If you have bone on bone, when we look at our models, which we talk about all the time, when you look at your model here, bring it in the picture here, your model here, you can see at the beginning a nice healthy disc right here. And then as we go down, you see how the spine compresses. This doesn't happen one day, doesn't happen 1 week. It happens over a period of months, if not years. Then you get arthritis, bone spurs forming, and then eventual fusion, bone on bone. So we want to avoid that. And even if you're down here or here, we still can help you. It just takes longer, and it's a little bit more difficult, and your prognosis might be slightly less. And that does not happen. What I just showed you there, that progression of your disc problem doesn't happen one day. It doesn't happen 1 week. It happens over a period of months, if not years. And you take a pain pill, you may do whatever therapy you're doing. You may do pain meds, you may doing, epidurals, whatever you're doing to make yourself feel good. And they give you this false sense of security that something's getting better. Now, in rare cases, the body can take care of itself and you're fine, maybe for a couple years, but it's only a matter of time because that compression will still occur. All the things we do, sitting, standing, bending, sitting more so than standing, bending, traumas, car accidents, slip falls, playing football, sports, jumping out of your truck, whatever it may be, all of that adds up, and the compression of the spine sets in. And then with that, the disc starts to degenerate, because we know after the age of 25, there's no blood supply to that disc anymore. There's no blood supply. So how can that heal itself? It can't. So what we offer is a treatment that's one of a kind. We're really the only one in the Pittsburgh area that offers it. There's over 300 facilities worldwide. 3,000 patients a day are being treated with VAX-D. So a lot of people call their devices decompression. And anybody can call anything decompression. We have a massage chair out in our therapy suite that claims decompression. But to truly decompress, you have to create negative pressure. And even so, people claim that they produce negative pressure. And if you look to date, the only research of its type that has been proven that a decompression device that actually creates negative pressure is VAX-D. The Journal of Neurosurgery, Ramos and Martin, 1994, so to date, the only research of its type proving that a non-invasive, non-surgical medical device, and this is a computerized, very highly sophisticated, if you want to call it artificial intelligence, sensing and using biofeedback when you're on the procedure to pinpoint individual disc levels and treat them. And when you create that negative pressure, and we are truly creating the negative pressure, unlike these traction devices or these decompression devices claiming to do it without any true research proving it, that negative pressure forms a vacuum, pulling the fluid and nutrients back into that compressed spine, getting a disc that's like, I'll show you here again, get in the camera, they didn't get this, it's like this or this, back to this again. Restoring the height, putting the fluid back into that starved, desiccated, degenerated disc, and also pulling the herniated or bulging disc back into place without surgery, without any complications. Completely safe procedure that has an over 92% success rate. And if you don't believe me, look at the research from Harvard University, Johns Hopkins, the Mayo Clinic, Duke Medical Center. We have the best research on VAX-D. We're not a glorified traction table. We're not a so-called decompression table that is claiming things. We wouldn't be around for this many years if this treatment didn't work. And we're lucky enough to have 4 tables right here at the American Back Centers. These tables are $125,000 a piece. Luckily, they're all set and they're all paid off and so on. And they've been helping people. And we've upgraded the technology to the latest VAX-D, the new Genesis system for the cervical region and the lumbar, getting pinpoint, so we can really pinpoint individual levels. And the patients are even more comfortable. Patients fall asleep on the procedure. They're seeing relief within the first couple treatments. It's amazing. And we're addressing the structural problem, not just treating symptoms and Band-Aids on problems. And this is a permanent correction. If you look at the research, and we send out informational booklets, and within the booklet there's tons of research, and there's one research publication done by a company that was researching their workers who were on workers' comp and getting surgery compared to getting VAX-D, and they found that their patients did much, much better with less time off of work, and it saved them thousands of dollars getting VAX-D over surgery without all the complications, the disability, the lack of success that you see with surgery. But more importantly, 4 years after VAX-D, the patients were still pain-free, back to work and doing what they need to do. And that's very, very important to note. So if you're out there listening to this podcast, you have back pain, you have neck pain, you're unresponsive to your current treatment, you want to avoid further surgery, pain medication, you've had multiple surgeries that aren't working for you, you're not getting any better, and people have told you, oh, my surgery worked for me, it's few and far between. In many cases, it may help temporarily because they took a piece of bone or disc that was pushing on the nerve, but the spine is still compressing, and it's only a matter of time till you have problems again. If your symptoms are radiating and your hip buttocks growing down your leg, radiating down your leg, foot drop, weakness, pain, give us a call. Again, we offer a non-surgical, a patented procedure that's FDA approved, over 92% effective, used by some of the best in the NFL, NHL, Olympic athletes and more, Major League Baseball, Tracy McGrady, Marilyn Mew, how could I forget Mario, to name a few that have used this treatment with great success, helping them avoid spinal surgery. It's a very, very important note. I have some, research I want to go over here with you, but even more importantly, a textbook, A Practice of Minimally Invasive Spinal Technique, published by the American College of Physicians and Surgeons and the American Academy of Minimally Invasive Spinal Medicine and Surgery, states in the book, chapter 35, quote, VAX-D should not be considered traction in the traditional sense, but as decompression. VAX-D is the only, this is coming from a medical textbook, not from us, the only non-invasive disc treatment that has been proven to truly decompress a disc. This is coming from a medical textbook used in medical schools. But yet they still push surgery, they still push medication. We all know why. The pharmaceutical companies have so much power, so much money, so much pull, so that's what they do, unfortunately. And I call it the gauntlet. Somebody goes through and they, self-medicate at home. They may go to their PCP and gets, Medrol dose pack, a steroid pack, muscle relaxers, which really do nothing. And I can talk about later today about how we have a natural muscle relaxant called Formula 303 that's even more effective. All natural ingredients. It's been used for many, many years in chiropractic offices, nutritionists, naturopaths, and so on with great success. Much more effective. You don't have the drowsiness because really Flexerol you should be taking during the day because you could fall asleep driving, fall asleep at work, and it just doesn't work. And at the very best, it's just a Band-Aid. Again, the body's natural response is pain and muscle guarding, muscle spasm. When you suppress that by, say, getting a massage or taking a muscle relaxant, all you're doing is suppressing it for a day. But the body's response to the problem until you fix the problem. Say you have a herniated disc or bulging disc. Until you fix that problem, that muscle guarding will keep coming back. So you're going to keep taking it every day. And you're not going to get anywhere because you're not solving the structural problem. And that's what we do with this treatment. And we have the evidence. We have the proof that what we're saying is actually occurring, unlike these other so-called spinal decompression devices that your local chiropractor, physical therapist, or even healthcare center may offer. Again, ask for VAX-D, vertebral axial decompression, VAXD. So important because it's the only one that has the research. The proof that it actually does it, says what it does, and has the over 25-year track record of helping people and helping them avoid spinal surgery without the risk of general anesthesia, without the risk of infection, without the risk of scarring or associated permanent complications, and without the risk of mobility loss. And we see that all the time. So if you are new to VAX-D, VAX-D was a breakthrough technology developed by Dr. Alan Dyer, the former Deputy Minister of Health of Canada, MD, PhD. He actually played a part in inventing the heart defibrillator, which we all know how important that is. It's in pretty much every building, saving people's lives. And if we didn't have it, I don't know what we would do. And a lot of people would not make it to the ambulance or not make it to the hospital in time when they have a heart attack or a cardiac arrest. So he played a part in inventing that as well as VAX-D. This was research to develop the VAX-D treatment was conducted over a period of 6 years with the combined efforts of physicians, engineers, and technicians at major hospitals. So again, we are doctors dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. Over 300 facilities worldwide. There's centers in India, Europe, VAX-D centers all over the country. We are Greater Pittsburgh area's VAX-D center. And make sure you have VAX-D because there's a lot of spinal decompression devices out there claiming to do what VAX-D does. VAX-D is one of a kind. It's unique, and the research speaks for itself. So don't wait until your condition worsens. Call us today. Our toll-free number is 1-888-222-8293 or 724-935-3300, 724-935-3300, and www.americanbackcenters.com is our website, www.americanbackcenters.com. So a little bit more about what we do here. Of course, VAXD is a medical procedure. It's the only FDA-approved, safe, clinically proven non-surgical disc treatment used by MDs, DCs, and orthopedic surgeons worldwide in over 300 facilities. 3,000 patients a day are currently being treated with VAXD treatment. We also treat the neck region, cervical region. So if you have cervical radiculopathy, bulging, herniation in the neck region, degeneration of your disc, or failed neck surgery, or you've been told you need surgery, get a second opinion first. Call us today. We do therapy and rehab, state-of-the-art facilities, individualized programs, ergonomic and postural instruction. So important for the overall picture. We treat any type of musculoskeletal issue, wrist, hand, finger, foot, ankle, knee, shoulder problems. We do the rehab for those areas. Very important. Massage, myofascial, trigger point therapy, acupressure, and reflexology. We do here. We do it all. Comprehensive nutritional consultations. We'll have to go over that someday in a podcast, how that works. Very comprehensive, and it's free. We could charge for it. We don't. And instead of throwing darts at a board, we're getting an accurate analysis of your nutritional needs based off of the symptoms you're experiencing. So you fill out this handout. It's pretty comprehensive. You bring it back, and we give you an analysis of your symptoms and what they mean nutritionally. Custom-made orthotics. We'll have to do a podcast on this too as well. Truly the best foot levelers. They make more foot levelers. They make more orthotics than anybody in the world. They are the best. And we have it here. We have a 3D scanning system where it's a free scan. You come in and we scan your feet. We now analyze it on the computer, and then we can set it off within 5 to 7 business days. They return via U.S. Postal Service. We fit them to your shoe, or you can get them built into a flip-flop or a sandal, and they truly make a difference for hip pain, ankle pain, foot pain, back pain, neck pain, all the way up that kinetic chain where the problems can be in the feet. And you don't have to have a foot problem to benefit from this. And people are seeing with knee pain and even back pain, immediate relief when they get the correction to those arches in the feet. If you're someone that's been walking around all your life through work, you have a job where you're doing a lot of walking or standing on a hard surface, your arches, you have 3 of them, believe it or not, eventually will diminish and go away. And getting a Dr. Souls off the shelf arch support really isn't specific to your individual problem, because everybody's foot is different. Very much like everyone's fingerprint is different. These are truly custom to your individual specifications, whether you have a little bit of foot inversion, you need a heel lift, you have 1 or 2 arches diminished on the right side as opposed to the left. Very individualized corrections that are only made when you get a truly 3D scan of the foot and get a custom-made orthotic. So we offer that as well for your shoes. Call our office. We can schedule a consultation and a scan, a free scan of the foot. 724-935-3300. As we mentioned, we do acupressure. We do x-rays in the office, diagnostic imaging, x-rays in the office, and we have a convenient MRI facility right across the street. So if you need an MRI, we can schedule that right across the street here as well. Some of the things that go into our program, we use it with other patients as well. We have a great product here. It's called ProEPA. Let me turn it around here. ProEPA. Dr. Maroon, who's the Steelers neurosurgeon, has done a lot of research on this product specifically. Not all fish oils are the same. Number one, you want to have a third-party tested fish oil. Nordic Naturals, all their supplements are third-party tested. That means a independent, not the actual company, not Nordic Naturals, verifies that what's in this product is actually in it. So you always want to make sure you have a third-party tested supplement. Most of the stuff you get at the grocery store, even Costco, even GNC, I was surprised, is not third-party tested. So sometimes it's not truthful. It's not really getting what you're getting, and you're not getting quality supplements. With fish oils too, I was surprised to see a lot of times they'll tell you how much fish oil, 2,000 milligrams, that's in there, but the concentration of the EPA DHA, which is the important part of the fish oil, is not good. It's not a high percentage. With Nordic Naturals and ProEPA, you're getting a high level of EPA of that actual fish oil, high percentage, upwards of 80% of the fish oil is EPA. The EPA content Dr. Maroon found, and many other doctors have found, is superior for reducing pain and inflammation. He found it comparable to Celebrex, Bextra, and Vioxx with no side effects whatsoever. So we offer this here as part of our program for our disc patients so they can get off the Vicodins, the Percocets, the powerful, sometimes addictive opiates, and even ibuprofen that may be ripping up their stomach and are just Band-Aids. So this can be a Band-Aid, but it's not going to rip up your stomach and will give you some health benefits as well. And then you get off it and we transition you into a regular fish oil that has a little bit more DHA and EPA, but more DHA for brain health and Alzheimer's memory, Alzheimer's, Parkinson's prevention as well later on throughout the course of your treatment if you so choose. But we recommend, you look at your labels because a lot of this stuff, the fish oils you get at the grocery store are not a high concentration of EPA and DHA, which is not beneficial for you. So Pro EPA is number one. The NutriDisc, great product for rebuilding cartilage anywhere in the body, shoulders, hips, knees, elbows, whatever, but we use it for the disc because the disc is made of fiber cartilage as well, so helping to rebuild the disc. So we give this to our patients as well, NutriDisc, which we're seeing amazing results with as well. And then from good old standard process, Boswellia complex with Boswellia, ginger root, and turmeric. Very powerful. Standard process has been around since 1929. Everything that goes in this product is a natural product that's coming from a real food source. Everything from standard process, that's what they do. It's a whole food supplement company. So you're getting the actual plant, the actual item, not a synthetic variation made in a lab like your One-A-Days and your Centrums made by pharmaceutical companies, again, that just have tons of money to advertise and convince you that their product is good, but in reality, in some cases, it's actually worse than taking nothing at all because you're putting a synthetic, unnatural vitamin A, vitamin C, whatever it may be, ginger root in your body that's nowhere near the actual real source product. So the Boswellia turmeric ginger root works exceptionally well with our patients as well. We're seeing great results with that as well. So a little bit more, again, we were able to help people with their chronic low back and neck pain issues without the use of drugs, injections, or surgeries. So if you're looking to treat your neck back pain, sciatica caused by a bulging herniated disc, degenerative disc disease, Facet syndrome, if you have spinal stenosis, in many cases that stenosis can be due to a herniated or bulging disc as well. So very important to note that when we look at your MRIs. When you come in, you may not have an MRI. You may only have an X-ray. You may only have, nothing. We can do the X-rays in the office when you come in. If we feel there's medical necessity, we can send you across the street for an appointment with an MRI. And really the only way you can see soft tissue and, an actual diagnostic disc problem is by getting an MRI. So we can send you to North Pittsburgh Imaging right across the street or any MRI facility you want to go to, and you can get that as well. So you can get the MRI done, and then we can truly diagnose your disc problem. So in addition, we've added some things to our program. Of course, we have the best cold laser on the market. This cold laser is used by some of the best in Major League Baseball, some NBA teams as well. It's endorsed by a group of doctors across the country, over 200 to 300 doctors, orthopedic surgeons, chiropractors, physical therapists that all specialize in disc conditions. We have it here. It's called the Microlight cold laser, and it's very effective for our patients with their disc problems as well. We've added to the program, to our disc protocol. In addition, if you have sciatica, unrelated to a disc issue, bursitis, tendonitis, arthritis, carpal tunnel, great success with that, knee pain, elbow pain, shoulder pain. We've had people come in for as little as 6 treatments, and they're getting pain relief and tissue regeneration with this very powerful cold laser. So if you'd like to give it a try, call us and you can schedule a free laser consultation, 724-935-3300. Again, 724-935-3300. So again, remarkable treatment. And I want to talk a little bit more. We've been talking a lot about us. talk a little bit more about, outside again. Just we're talking about the winter weather safety. We posted some articles up here in the past too about winter safety. Make sure you're careful out there. When you're shoveling, whatever you may be doing outside, take breaks. Take breaks. I just want to remind you that. So the article today that I want to touch on, and I'm going to put it up here in a second, is talking a little bit about, it's our PowerPoint presentation on the actual VAX-D and disc problems. So we're going to put it up here. Hope everybody can see it. And then we'll get it started here, and we'll get a little slideshow. And we'll put it on a little bit. All right, perfect. And keeps jumping around there. We're gonna get it here. All right, so there's a little bit about myself. Owner of the American Back Centers, 22 years in private practice, nationally certified in spinal decompression. Over 10,000 spinal decompression treatments with VAX-D performed by me. So I've been around a while, and I've seen a lot of disc cases. A lot of disc cases that have come through our door that we've been able to help. Not everybody, but we can help a lot of people that come into our office. A lot of people suffering with disc problems. We can definitely help them. So again, offering the Pittsburgh patients suffering with chronic disc disease a non-surgical, non-invasive solution to their chronic back and neck pain, resulting in a better quality of life. How do you avoid back or neck surgery? Non-invasive approach we offer here. Do you have low back pain, neck pain, pain radiating down your arm, legs, numbness, tingling in your hands and feet, weakness in your arms, hands, legs, feet, unable to stand or walk for long periods of time? You've been told you have a disc bulge or herniation, sciatica, degenerative disc disease, spinal canal stenosis. You've had an MRI or X-ray. You've had chiropractic. You've had acupuncture. You've done epidurals, cortisone injections. You've tried physical therapy, even tried surgery. Here's a picture of a spinal fusion with the fixed hardware, the rods and screws. A very, very invasive procedure. The big question is, how many of you still suffering with the same chronic back or neck pain? You're not alone. As you see the stats here, affects up to 80% of Americans at some point in their lives. It's the most common disability among people under 45 years of age. Costs more than $100 billion annually in the U.S. Over $20 billion of this total is spent on back surgery. More than 1 million Americans undergo back surgery yearly. This rate has doubled that most developed countries, and 5 times that of the United Kingdom. And 72% that got spinal surgery needed further surgery. 72% had to repeat. Why are the incidents increasing despite new drugs and new surgery options? You would think things would be getting better, but it's not. Is it possible we're not doing the right thing? Many specialists believe that 75 to 80% of lower back and neck pain comes from the disc. You can see a little bit of, you can see the nucleus, that's the fluid in the disc, the cartilage fibers, annulus fibrosis, the end plate, a little bit of anatomy there. 2 main causes of disc problems: disc degeneration, which I just talked about in the early stages of the podcast here today, disc herniations, bulging disc, slip disc. What is a disc? Nucleus pulposus, annulus fibrosis. So the nucleus is in the middle, the fluid. The rings, the cartilage that contain the fluid is the annulus fibrosis. This disc acts like a sponge, acts like a shock absorber to the spine. Absorbs pressure and vibration, allows for motion, and acts as a spacer, and is dynamic and is necessary. We all know after the age of 25, there's no blood supply to the disc. Does not have any internal nerves. The disc itself is an active tissue that contains significant mechanisms for self-repair. It has a natural pump mechanism which keeps the disc hydrated and healthy, and it's made of 86% water. You can see here again, normal disc, a disc that's compressing, degenerating, a disc that's bulging, or herniated disc, and a thin disc, and you can see a really thin disc with osteophyte formation where the bones are starting to become arthritic, arthritis of the spine. and eventually they'll fuse and you'll have a big problem. Same thing happens in the neck, of course. Bulging herniated disc. This is a condition where a tear allows the disc material to push against the annulus of the fiber. Colorado University study in the mid-1990s showed only a 10 millimeter mercury will reduce the effectiveness of a nerve. So only 10 millimeters of compression on a nerve can actually affect the functionality of that nerve by more than 60%. That's only a weight of a dime. Weight of a dime. You can see healthy disc here on an MRI, and you can see unhealthy. Losing the water. The white is the water. Losing water, getting black or darker, and then the disc material is starting to bulge. Unhealthy. Herniated disc or slip disc irritates the nerves in the low back, causing pain, numbness, tingling, muscle weakness, muscle spasm. These symptoms travel down the leg. This is known as sciatica. They have lost their innate ability to keep itself healthy and hydrated. Their pump mechanism has failed. The movement-driven pump mechanism compresses and relaxes pressure on the disc, pumping water and waste in and out, and water nutrients in and out. The failure of this pump mechanism results in biochemical changes, causing disc conditions like bulging, herniation, degeneration of disc, and varied symptoms. And you can see that here, the water in, water out. That's not happening anymore, so the disc starts to compress because it's being starved of nutrients, losing water, losing oxygen, losing health, degenerating, desiccating. Failed pump, loss of circulation, causing a condition, and then eventually your symptoms. So you have these conditions well before you have any symptoms, and that's really the scary part of it all. So how does this all happen? How does the pump mechanism fail? Stress, physical, trauma, aging, motor vehicle accidents, sports injuries, chemicals, smoking, drinking, prescription meds, all put stress on the body. Emotional, finances, romance, kids, jobs, all the things we have stress about. Being a parent, relationships, money, jobs. Sitting too long is one of the biggest problems. Poor posture, being overweight. Every extra pound of weight adds up to 8 extra pounds of force on the joints. So what is the current approach? Is it working? What is your current approach? And is it working? Most people are using pills, as we mentioned, muscle relaxers, pain pills, physical therapy, stretching and strengthening, chiropractic, adjusting and aligning the spine. Not to say that those two things are not good, but in many cases we see patients all the time that come to us that have tried those things and now it's not working for them. Working for you. Acupuncture, same thing. Epidurals, cortisone injections. Strong anti-inflammatory, but only give you a temporary fix. In some cases, can make you worse. And if they're off by even a few millimeters, they can paralyze you. Surgery, of course, we all know, very risky, low success rates. So what do all these things have in common? So we'll give you a little warning because there's a little scary picture coming up here. There it is, a back surgery. They lead you to surgery because that's what happens when we talk about that gauntlet. That you start with self-medicating, then you go to physical therapy or chiropractic. In many cases, when that doesn't work, they send you to a pain clinic for epidural, pain injection shots. When that doesn't work, you go to a surgeon. The surgeon says, come back and see me. Only if the pain is unbearable. You go back and do more physical therapy, maybe some chiropractic, acupuncture, do some more epidural injections, corticosteroid injections, and then finally you get this, spinal surgery, and if they put rods and screws in you, this is the way it looks like. Very, very invasive, high rate of complication, low rate of success. And you can see the spinal surgery fusions here on X-ray. Nearly 1 in 50 back surgery patients dies within 3 years of surgery. That's crazy. Death rates are significantly higher when analgesics are involved. Mortality rate increases 7-fold when these cage devices are used in conjunction with anesthesia. So if you get a fusion surgery, your death rate increases 7-fold over doing nothing. And 1 in 50 back surgery patients dies within 3 years of the surgery. So we're not just talking about complications, scar tissue, lack of success. You have a risk of dying. sevenfold, especially when you're getting the fusion surgery. So you can look on and down here, you can see that less than 25% were completely successful. Even though these back surgeons will tell you they have a 70 to 80% success rate, the research is there. Only 25% completely successful, and that's a healthy rating there. The majority of the patients, the surgery does not have a dramatic impact on their pain or mobility, and they have to go back for more pain meds, more procedures, more surgery. So the cost of back surgery in the U.S. is $6,000, $8,000 with the standard surgery, and then when you get the fusion with the hardware, $60,000. Lumpectomy, $85,000. Additional costs include prescription medication costs, which are going to come out of your pocket. Physical therapy, that's going to come out of your pocket. Hospital wages and fees coming out of your pocket. Lost wages for you. Time off work. Post-surgical complications, including more surgeries, costing thousands of dollars to you, let alone co-insurance, co-pays. These things aren't free. Even if they are so-called covered by insurance, there's a lot of other costs involved. So how much does your health and your future mean to you is the question that they ask here. You know, you look at your copay, even if you had a copay of 20 to 30%, you're looking out-of-pocket expense $11,000, $16,500 out-of-pocket expenses with medications, rehab, the cost of surgery with your co-insurance. More importantly, you're wasting time. Time with your family, friends, golfing, traveling, doing all the things you enjoy because you are recovering and not working. So you're losing wages there as well. Spinal surgeons frequently claim 95 to 98% success rate. Realistically, 25 to 50% is what it is. Infection, nerve damage, permanent disability, coma, paralysis, death, failed back surgery, additional surgeries, pain medication, addiction, and depression are just some of the risk factors, complications of spinal surgery. So what else can we do? What can you do? We offer an alternative approach here at the American Back Centers and the Disc Relief Centers of Pittsburgh for your low back, neck pain without the use of drugs or surgery, as we just mentioned. We offer a 5-step approach. Step 1 is VAX-D. Step 2 is therapy, laser, EMS, etc. Step 3 is intersegmental mobilization. Step 4 is nutritional wellness. And step 5 is exercise rehabilitation, which is a very important part of our process. So what is VAX-D? We just talked about. Developed by Dr. Alan Dyer, MD, PhD. Developed the heart defibrillator. Dr. Norman Shealy, MD, developed the protocol for VAX-D and spinal decompression. Spinal decompression is spinal distraction without muscular contraction. And that's very important to note. So we can target one specific disc at a time. Senses the muscle contraction 4,000 times per second, resulting in less muscle spasm and guarding. Creates a negative pressure within the disc, which causes a vacuum effect to suck in water, oxygen, nutrients, and disc material back into the disc. So we heal the disc from the inside out. Decompression of the spinal disc produces negative pressure. This was again published in the Journal of Neurosurgery, showing that a negative pressure is performed every time you receive VAX-D procedure. So you can see the everyday pressures, positive compressive forces, bending over to pick up a box, positive 800, even squatting to pick up a heavy box, 300 positive, lying down, etc. VAX-D is getting a negative. That negative pressure is very important to pull water, nutrients, oxygen back into that compressed, starved disc, and also pull the disc back into place. So pulling that water, nutrients back in, fixing the pump, increasing the circulation, healing the cause of the problem. VAX-D can make a physical change to the disc and the true change to your condition, rehydrating your disc, increasing your disc height, reducing disc herniation size, taking pressure off your compressed spine and nerves, recreating the pumping mechanism that's failing in your spine and disc, which results in less pain, increased motion and function, and a better quality of life. So safe that even mom goes on it. We have a patient that's 100 years old currently that's currently getting the procedure. How long does the treatment take? anywhere between 30 to 45 minutes on the table. You're looking at about 30 to 50 visits because it does take time to pull a disc back into place and heal these problems that you've had for many, many years. 8 to 12 weeks. Total treatment time in office anywhere between 60 to 90 minutes. Most patients see results within 2 to 4 weeks. So step 2, we talked about the therapy, including cold laser therapy, electric muscle stimulation, intersegmental mobilization, which we do, which is step 3, helping with the alignment of the spine to allow for proper biomechanical functioning to all joints and proper movement. We talked about the cold laser as well earlier on in this podcast. Step 4, nutritional wellness. We talked about some of the things we use, the Pro-EPA, Boswellia complex, NutriDisc. And we have an anti-inflammatory diet. Removing these inflammatory foods from your diet is very important, part of our protocol with our patients. And then step 5, exercise rehabilitation, using a rehab program to strengthen your core. Also the power plate rehab, accelerated training, which helps to strengthen and stabilize the back neck to support structural changes. So what types of treatment actually work on the disc? We all know all these things are not really addressing the actual disc and addressing the structural compression of the spine. Surgery does to some extent, but it weakens the disc. It's invasive, it's risky, and has low success rate. Of course, VAXD does. We know that. What conditions will the TDC method here at American Back Centers and VAXD successfully treat? Well, herniated disc, bulging disc, degenerative disc disease, spinal stenosis, facet syndrome, sciatica, brachial neuritis, and chronic neck and back pain. Look at these case studies, pre and post MRI. Look how this disc is herniated, and look after VAXD how it's being pushed back into place, opening up this, getting water back in and pulling that off the nerve out of the canal. Amazing before and after MRIs. 219 patients with herniated degenerative disc, 86% showed improvement following VAXD. This is from Orthopedic Review, Technology Review. Only 2% had problems within 90 days. Mayo Clinic study, average pain score was a 6.4 out of 10. Pain for more than 6 months. After only 20 treatments they were given over 6 weeks, their pain levels dropped to a 0 to 1. And this is coming from the American Academy of Pain Management. Mayo Clinic post-treatment, significant pain relief in 88.9% of patients, showing dropping from a 6.4 to a 0.8, which is basically 0 out of 10, requiring fewer drugs after treatment, no safety issues, no adverse side effects. So look at that, 6-week period, how that pain dropped, and we took care of almost 90% of patients without the risk of surgery. Long-term results, even 4 years later, 91% resumed their normal daily activities, even 4 years later. How do we determine if you're a candidate for our treatment? We do a comprehensive consultation and examination when you come in, thorough orthopedic and neurological testing, x-rays if needed, and we can send you for an MRI right across the street if that need be. And we'll have you come back and we'll do a report of findings on whatever we've done, x-rays, MRIs, etc. So is VAXD treatment your best option? Of course it is. Because our mission, our purpose is to help as many people as possible, we do offer a special offer for you. And anyone out there listening to this podcast, we do offer a free consultation for you. We are so confident when you come in, we also offer one free treatment for patients as long as they're cleared, and we clear you for the treatment. There are some contraindications to the treatment. If you're pregnant, if you have weak bones, osteoporosis of a severe nature, and we can determine that based off of a bone density score. Many people with osteoporosis can still get the treatment. If you have some other issues like a severe fracture or instability of the spine, you would not be able to get the treatment. But even so, we will let you try the treatment and see the results. We're so confident in our treatment when you come in for your consultation at no charge. So again, call us today, 724-935-3300. Visit our website, www.americanbackcenters.com. And again, you can learn more about what we do by visiting that website and calling the office if you have any questions. Of course, scheduling that consultation, don't wait until your condition worsens. Call us today, 724-935-3300. 3300. We're just going to get out of this here. And just to finish up with the show here today, again, I want to thank everyone for listening and being on this podcast with me today. We're going to be trying to do podcasts on a weekly basis when we have time. And we're located right here in Wexford, right here in the Cranberry, Wexford area at 103 Bradford Road, Suite 100, Building 2, Suite 100, right here in the Stonewood Commons office complex, and Dr. Central here in Wexford, right down from the new hospital, right in between all the car dealers there, the Bentley, the Jaguar, and the new hospital there, and Walnut Grill, if you're familiar with that area too. That's where we're at, right at that dip there at the light. So visit us, give us a call if you have any questions. I want to thank everyone for listening today. Have a good week.